Augusta Health is an independent 255-bed community hospital in the Shenandoah Valley. We provide a wide range of services here, from surgical to pediatric to obstetric, gynecologic, psychiatric, and a broad range of medical and medical subspecialty services.
A key element that every hospital CIO faces is the need to protect the confidential information of our patients. As a result of that, we put a number of barriers in place to using our systems. We want our users to have long passwords. We want a two-factor identification if we can. The physicians have, for a long time, seen information technology not as their friend, but as their foe. We needed to turn that upside down. And the way we do that is by using technology to reduce the barriers, but at the same time improve security. And that's what we've been able to accomplish with Imprivata. If we look at the amount of time we were using a year ago for our providers, nurses and physicians, to log in and log out of systems, physicians routinely would complain about what it took to use our systems.
Particularly in the emergency department setting, we are in and out of our rooms a lot. We have to multitask. We go from one room to the next, and it was just a tremendous amount of manual intervention, and it just created a lot of wasted time and inefficiency when we're already pressed for time. The new Imprivata system we're so much more efficient in many ways. First of all it takes to get into the computer system is basically a tap with your badge, and it doesn't matter whether you're trying to get to the desktop or trying to get to the EMR. It's a single tap. And then the same to leave the system is a single tap.
They will come in and establish a desktop. They will come in with their badge and get a desktop first thing in the morning. It will ask them both for the badge and for a PIN for the second factor authentication. After that initial setup, which takes about 15 seconds, their environment is established for the day. They now can go to any device, badge in, and in about a few seconds, be back to the same screen that they just left. No more navigation, no more needing to go find that patient record. So if I take what used to be a 1-minute process each time they logged in and translate that into the average 5 to 10 second process that a nurse now uses with Imprivata, if we realized the nurse was doing this process 30 or 40 times each 8-hour shift, and then think of the hundreds of nurses we have working at any given time, 24 hours a day, 7 days a week. And pretty soon the savings adds up to hours and days.
One of the hurdles to adopting computerized provider order entry is that physicians sometimes ask, I'm doing this for the system, what is the system doing back for me? And when the physicians saw that the IT department was introducing this badge-in system with the ability to do single sign-on, they could feel that the system was leaning back towards them, trying to make it as easy as possible. The Imprivata system was a visible, tangible, and very functional demonstration that the hospital was trying to help providers.
At the end of 12 months of implementation, we have achieved a 75% utilization rate of CPOE for all inpatient orders.
What we found, though, very rapidly with the rollout of the Imprivata process and the ability to badge in was that doctors who were late adopters of using the computer at all would see their colleagues go into devices, badging in and being right where they needed to be with no typing. And then even those late adopters would start calling up the IT department, emailing me saying, hey, how do I get my badge set up to do that?
Oh, if we had to go back, yeah, I'd be looking for some new staff if we went back to the way we did it before. Once you get used to something that works, you don't want to mess with that.
After 12 months of use of single sign-on with Imprivata, it is taken for granted as much as we assume the telephone will work. There is an assumption by my providers that Imprivata will work every day, every time.